A very, very good morning and welcome to the Apollo 24/7 family members. Health Hour is a show where we give you information regarding your health. There's so much information, awareness that you can take charge of your health. Most of the time that we are searching for information and we don't know where to go, who to consult. So here we bring you an expert from Apollo Hospitals every week where you can ask your questions even before consulting, actually making a booking an appointment with a physician or a surgeon. So today we are going to talk about piles, remedies, surgeries and beyond. On the show we do have a health quiz on the same topic. You can watch the topic, participate in the health quiz and get gift vouchers from Apollo 24/7 as well. I recommend that you download Apollo 24/7 app, which brings all the services of Apollo Hospitals to the convenience of a mobile phone. On the show, we are going to give you discount vouchers and coupons that you can use on Apollo 24/7. So I've introduced the topic. Let's start and dive deep into the topic. If you have any questions or queries, you can participate. You can type your questions or queries in the YouTube chat of Apollo 24/7's YouTube channel, and we can take these questions up. I'm going to place them before the expert. Today, we are having a very, very senior and a very experienced surgical gastroenterologist from Apollo Indraprastha Hospitals, New Delhi, Dr. Arun Prasad. So here's Dr. Arun Prasad, who can be consulted for a lot of gastrointestinal gallbladders and cancers of gastrointestine and many other issues. He is a very, very senior person and इनके memberships भी काफ़ी है, specializations है. Let me quickly introduce and welcome Dr. Arun Prasad. Good morning, doctor. I'm unable to...
Good morning.
Yes, very, very good morning. I see that you have a varied range of experience in the field of surgical gastroenterology, which makes us really proud of you and your achievements. Congratulations on serving in the medical field for so long. Thank you for your time on the Sunday morning.
Thank you.
So, आज का टॉपिक है piles, remedies, surgeries and beyond. While this topic says so much, it is also comprehending the fears, the causes and the remedies all together. तो पहले आप हमें ये बताइए, what are piles? Why are people ashamed और इतना stigma क्यों है around piles?
Okay. So piles is a problem which is very exclusive to human beings, और ये इसलिए है क्योंकि human beings ही ऐसे mammals हैं जो कि खड़ा होके चलते हैं, और इससे क्या होता है कि all the pressure of the intestinal tract blood that comes down into the rectum. So this leads to a high pressure zone there, and people who are prone to piles, and more or less we can say that it's a lifestyle disease, they can develop problems related to the blood vessels of the anorectal area or infections in that area, which can lead to piles, fissure and fistula, which are the three terms which go together, but it's popularly known as piles.
Right. तो आपने जैसे you have differentiated that these are three different issues, but popularly go under the umbrella of piles आपने बोला है. तो rectum या anal area के पास जो भी हमारे bleeding चल रहा है, not all bleedings are, not all cuts or not all growth are piles. So you have specified the terms called piles, fissures and fistula. Can you please throw some light on these three, sir?
ठीक है, तो पाइल्स क्लासिकली ऑल्सो नोन एज हेमरॉइड्स, एंड हिंदी में जिसको बवासीर कहते हैं, इसमें प्रॉब्लम होती है ब्लीडिंग की, और जो हमारे रेक्टम में एनोरेक्टल एरिया में जो ब्लड वेसल्स हैं वहाँ से ब्लड आता है, एंड पाइल्स इज टिपिकली अ पेनलेस ब्लीडिंग दैट हैपर्स. सो पेनलेस ब्लीडिंग अगर हो रही है, जैसे कि नलके से ड्रॉप्स आ रहे हैं, then that is usually known as piles. Fissure is a different condition which is actually much more common than piles. Fissure में क्या होता है that the lining of the rectum वो छिल जाता है, it gets abraded and you get some sort of a scratch inside your rectum. This leads to severe pain while passing motion or just after passing motion, and because there is a scratch, there will also be a little bit of blood which will be seen around your stools, but not as much as you would see in piles or bawasir. The third condition is what we are calling as Fistula, and fistula also known in Hindi as Bagandar. This is a track. So this usually comes after an infection, and after an infection, the skin around the anal canal, it becomes red and bursts, and you can see some pus and bloody material coming from time to time. So this takes a up and down graph. कुछ दिन आता है, फिर कुछ दिन ठीक हो जाता है, फिर कुछ दिन आता है, फिर कुछ दिन ठीक हो जाता है, and this is what is known as a fistula, which basically means a track between your rectum to the skin outside.
Wow, very clearly, very simply, and very effectively explained, doctor. Thank you so much, Dr. Arun Prasad. So now you also mentioned कि piles में जो bleed होता है तो उसमें pain नहीं होता है. You said that there's not much of pain or there's no pain at all. How does one understand that they have piles?
Yeah, so piles is painless bleeding, as I said. However, पेन इज अ फीचर ऑफ अ कॉम्प्लिकेशन ऑफ द पाइल्स. सो अगर पाइल्स बहुत बड़े हो जाते हैं, बाहर प्रोलैप्स हो जाते हैं और वो उनकी ब्लड सप्लाई खराब हो जाती है या वो इन्फेक्ट हो जाते हैं, तो एडवांस स्टेज ऑफ पाइल्स में पेन होता है, विच इज मोर और लेस सीन एज अ कॉम्प्लिकेशन ऑफ पाइल्स. बट पाइल्स टू स्टार्ट विथ इज क्लासिकली पेनलेस ब्लीडिंग.
ओके, सो अगर फिशर है, छोटे छोटे कट है, देयर आर स्मॉलर कट्स एंड देयर बाय द फिशर्स. Do you hear me, sir?
Yeah, I can hear you.
Yeah. So when they cut, the fissures are smaller cuts, wherein the stool can be lined with blood. You said, but fissure can create pain.
Fissure always creates pain because of that cut. The nerves underneath get exposed, and fissure is a painful condition where people get pain while passing motion, and even after finishing passing motion, the fissure pain leads to spasm of the muscle and the pain stays on for an hour or two.
Are these three different or very different from each other, or are they connected? Like for example, piles can become fissure can lead to fistula. ऐसा कुछ है क्या sir?
नहीं, they are all three are different.
So a cut in the rectal area, which is a fissure, cannot lead to a pile or a hemorrhoid.
No, no, it doesn't.
Okay.
But they can coexist.
So,
They can coexist. Somebody could have piles as well as fissure, but one does not lead to another.
Okay. So terms काफी separate हो सकते हैं, but एक ही region के अंदर जो anal region या rectal region के अंदर जो आ रहा है, so people can get confused is what we've understood.
Yes,
Harish Iyengar ji is asking, anal prolapse क्या है?
So anal prolapse और rectal prolapse is a totally different condition. इसमें क्या होता है कि जो आपका अंदर rectum होता है, जो मोशन का रास्ता है, because the tissues around it become loose, the entire rectum comes out, and that is known as a rectal prolapse. एक बार rectum बाहर आ जाता है तो फिर वो इंजरी हो जाती है, जैसे कपड़ों से, अंडरवेयर, अंडरगारमेंट से, so it can get ulcerated and can lead to bleeding. So anal prolapse is a totally different condition. It should not be confused with prolapsed piles, क्योंकि you can have piles which can also prolapse out. So जो piles बहुत बड़े हो जाते हैं, we have various degrees of piles known as first degree, second degree, third degree and fourth degree. Very briefly, first degree is the starting where nothing is visible, only blood comes. Second degree is when some part of your lining comes out during the bleeding or while passing motion, but then again it goes back after you have finished. Third degree is when part of the lining comes out but stays out permanently, and fourth degree is when the piles get complicated. Now, so this is a prolapse of the lining. However, rectal prolapse is where the entire rectum prolapses out and comes out of the anal canal.
Wonderfully explained again, doctor. So the rectal prolapse is a very different thing, but to a prolapsed piles. So you also were mentioning the multiple grades of piles. Does it start with one grade or the basic level of piles and then move on, or anybody can start at any level? How is it, sir?
No, it always starts at level 1, and as time passes, it goes to level 2, 3, 4. So there are many people जिनकी पूरी जिंदगी piles grade 1 ही रह जाती है और आगे कोई प्रॉब्लम नहीं आती है. कुछ लोगों का ग्रेड 1 होता है और एक साल के अंदर अंदर ही ग्रेड 4 हो जाता है, एंड दैट इज समथिंग विच वेरीज फ्रॉम पर्सन टू पर्सन, एंड वी कैन नॉट प्रेडिक्ट कि किसके पाइल्स कितने सालों में एक ग्रेड से दूसरे ग्रेड तक प्रोग्रेस करेंगे.
And then there's so much of stigma around it that people don't want to talk about piles and their progression or treatment options. So there are also, while there is stigma, I always understand that it doesn't allow you to access right information or right awareness. Do you agree, doctor, that people shy away from asking for
Yeah.
help?
Yeah, I fully agree with you, because there are certain diseases or illnesses which you would not talk about in a party. You are not going to be sitting around in a party and say that, okay, I've
Yeah,
got
जैसे
piles.
आप डायबिटीज के बारे में बात करेंगे, आप पाइल्स के बारे में बात करते हुए नहीं देखते हैं.
बिल्कुल बिल्कुल. So that is, I think, more or less because of the region involved. Nobody would like to speak about their rectum and anal canal in a party.
Totally understandable, doctor. So, secondly, concerns of piles जब शुरू होते हैं, the connection between constipation and stool, the consistency of the stools, इनमें क्या connection है?
ठीक है, ये सवाल बहुत अच्छा है, क्योंकि दिस सवाल और दिस क्वेश्चन लीड्स टू द bigger question as to why piles occur. So piles is, I see, a lifestyle disease where our current lifestyle creates a situation where we are not able to take a high fiber diet, we are not drinking enough water, regular exercise is missing, people are straining while passing motion because they are getting late for school, college, office, and these bathroom habits are there. Then even the sitting routine where you sit for long periods on your chair, so, or in a squatting position, so this sitting can also lead to an increased pressure, because if I'm sitting, the entire pressure of my GIT is going on to the rectal area. So the constipation is again related to your fiber, lifestyle, hydration, and again constipation means straining. So जब आप strain करते हैं तो अंदर का जो आपका pressure होता है rectum के अंदर, वो pressure बढ़ता है, और pressure बढ़ने के कारण जो वहाँ के blood vessels हैं उन पे अगर आप constant pressure आप डालते रहे तो धीरे धीरे वो खराब हो जाते हैं, और जब वो खराब हो जाते हैं तो फिर उसमें से ब्लीडिंग हो जाती है. And the same constipation and lifestyle problem which I am talking about leads to a hard stool, which while passing out can actually rub on the lining and lead to a fissure. The same increase in pressure can lead to some bacteria which is there inside my rectum to get pushed into the lining and go out of the lining into the tissue around the rectum, causing an infection there, which will eventually lead to a fistula problem. So all these three problems, while they are different, the root cause is the same, which is like sitting on the toilet reading newspapers, or you don't get off the toilet till you have seen all your WhatsApp messages in the morning. So sitting in that position, straining for too long, the pressure which increases in the rectum is more or less related to all these problems.
So lifestyle, food, constipation, daily habits, and then also postural related issues are what you've highlighted, doctor. This is the,
Water,
as you
water,
said, water. Yes, of
drinking
course.
water.
Drinking water, lack of fiber in food, all of
Yes.
these. So if you can control the factors which are lifestyle factors, do you think one can totally avoid piles in their lifetime?
So right. So you cannot totally avoid piles, because piles also has a small element of running in families. So you will have people who have a tendency of having weakened blood vessels in that area. So those who have slightly weakened blood vessels, or the lining is more delicate, then those people can be more prone. But yes, by uh, following the lifestyle patterns, people who know that okay, their parents suffer from piles, they can uh, avoid it to a great extent.
So ये progression of piles in from grades, that's what you mentioned, ki anything can start with the basic grade or the grade 1 and then progresses. if you are aware, if you are conscious, and if you have made enough changes in the grade 1 itself, can you avoid the progression?
Yes, you can avoid the progression, and you can avoid further pressure related injury to the piles which are existing. So by taking high fiber diet and making sure you don't get constipated, having regular bowel habits, that means you're not going to the toilet one day at 8 in the morning, one day at 11, not confusing the body. So just to regularize your bowel habits will prevent the progress of piles from grade 1 further down.
Great, sir. So let me move on to the questions which are being asked on the YouTube chat. Mr. Ashish Kumar Panda, this is a very, very common question that we find around piles. Does consuming spicy food lead to any of piles or fistula or any other diseases that we're talking about?
No, the spicy food in itself does not lead to causing piles fistula, but what goes along with the spicy food could lead to, because you are having spicy food, you may be drinking less water, you may be having less salad or vegetables. So, it goes along. So, it's part of the thing. And when you have, say, a fissure, so just imagine if there is a scratch there in the rectum, and at that time you are having spicy food, then those spices are definitely going to create more burning and irritate that fissure, which will slow down its healing.
Right. So directly नहीं है पर है नाता. So जब खा रहे हैं तो you should make sure what you are eating along with it, and high fiber and good hydration is the key to it. Wonderful. Thanks Ashish Kumar Panda ji. Keep asking questions because your questions are very important. क्योंकि हम लोग टेक्निकल अगर यहाँ बात करते बैठेंगे, you will get information, but आपके जो doubts है वो clear नहीं होंगे. So please go ahead and ask your doubt. However you feel that it is not significant or insignificant, please do go ahead and ask the question. So next question is Mr. Purushottam Reddy. He says, if I get a pile surgery done, how many days will we have pain after the surgery? So let's also talk about what are the surgical options and who requires piles ke liye surgery.
Right. So surgical options, again, we have a wide spectrum. I'll take 2 minutes to go through all this. So to start with, if it's an early piles, grade 1 piles, we could get away by just giving some injections into the piles. It's an outpatient procedure, it's totally painless, and that can lead to shrinking of the piles. Subsequently, if you improve your lifestyle, then the piles may not come back again. That's the most simple treatment. It can be given in early stages. As the piles increase in size, the next option could be to put a rubber band around the piles, to give infrared therapy, and again that causes shrinkage. Further, when the piles increase, then comes the surgical options, and today there are 3 main surgical options which we have. One is what is known as laser hemorrhoid surgery, and when we talk about laser hemorrhoid surgery, this is similar to the injection which we are giving. However, this is given in the operation theater, and by laser we basically burn out or ablate these piles. The second option is what is known as a stapler pile surgery, whereby we put in a stapler inside the rectum. Again, this is done inside the operation theater, and the piles part is selectively stapled and removed. So the stapler actually cuts off the pile and rejoins the area concerned in the same go. So that's another option. The third option is more for complicated and advanced piles, especially piles which are coming out, which is the standard hemorrhoid or pile surgery that has been going on for a long time. However, there have been advances in that also, because you can cut it with very fine electric cautery or even by laser, so that the patient gets less pain and less problems. So these are the few options which are there. Generally, after pile surgery, you are kept in the hospital for 1 day. 3 to 4 days rest at home is required, and most people are able to go back to work in 7 days, but there is a rider there. This depends upon the complexity of a problem. Naturally, somebody who seeks out treatment early, who has smaller piles, will take less time to recover, and somebody who has a large piles, who has got a complication with the piles, will take longer time to recover. While on the topic, treatment for fissure is again mainly medical. We give creams and ointments and things like sitz bath, and 80% of the fissures get treated medically. 20% need a surgery, which is a very small surgery, much smaller than the pile surgery. Again, 1 day hospital stay and people recover very fast. Lastly, coming to fistula, fistula can be simple fistulas and complicated fistulas. Simple fistula again requires 1 day stay and gets the recovery is quite fast. But there could be complicated fistulas which could be involving the muscles that control your motion, and in that case the treatment can also become complicated. It can be a staged treatment where we do the surgery in stages, or we put in what is known as a thread seton, also known as shar sutra in the Ayurvedic circles. So there are many options which are there, and again, once you meet a doctor who specializes, they will be able to assess and guide you as to which is the best option for you.
Wonderful, sir. So here I have three questions to in connection. One, key, you have to come early. You have to get yourself detected so that the procedure is easy. Whichever surgical laser or injection, जो भी जिसको suit होता है, that's going to be first thing. Secondly, यहाँ पर over the counter try करने के बाद काफी सारे other options, they don't want to come. Surgery is something that they want to push it to the last. People fear surgery, so they go to multiple other options which are available. In the bargain, they also go to the quacks जो टेंट्स में भी लगे रहते हैं. इतना कम अवेयरनेस है हमारे यहाँ that we don't you don't even know क्या complications हो सकते हैं. One, if you delay your treatment, क्या complication होता है. Two, getting the wrong treatment, क्या complication हो सकता है.
Right. So delaying the treatment will only make life worse for you because it's a nuisance and painful problem for you. It is not, say, a cancer which we are dealing with. तो ऐसा नहीं है कि कैंसर बढ़ जाएगा. एंड जब पाइल्स आपको प्रॉब्लम कर रही है, then it's best that you seek out treatment. Early stages which I mentioned, stage 1 हुआ या early fissure हुआ, इन दो situations में आपका conservative management does work. People do what is known as sitz bath. Sitz bath is basically taking a tub of water and sitting in it for 10 minutes in the morning, 10 minutes in the evening. What it does, it relaxes the muscles and takes the pressure out of the rectum. So a lot of problems, early fissure, early piles, just by drinking enough water, having enough fiber and taking sitz bath can get rid of the problem. You do have creams which are used. Again, the cream's basic purpose is to relax the muscles and reduce the pressure. Only word of caution with the cream is please do not use creams which have steroids in it. And that is where, when you mentioned quacks, the problem can occur, because if you take steroids, your initial symptoms will get better. You'll feel wonderful. But what the steroid will do is it will damage the lining. It will make the lining more thin. And when it becomes more thin, it becomes more prone to bleeding. So initially आपको फायदा होगा, but in the long run, the steroids is going to be very harmful. So do not use creams which have steroids in it. And there are.
So can I interrupt you here, sir? Can I add a question here from Mr. Kuldeep Singh regarding the creams? Because anyway, you have come to the creams and steroids question. Mr. Kuldeep Singh is asking, how long can I apply the Ocil cream to push grade 2 piles? I'm using it more than past 20 years.
See, if it's working for you, if it's not causing you any problem, then I have no problem. So you can continue to use it. As I said in the beginning, people can live with piles for the rest of their life. If you are comfortable with your piles, I'm okay with it.
Yeah. So that's your answer. Very simple. Yes, sir. Please continue, sir. So I was asking about complications of leaving piles, and you were about to answer something about the steroids and the creams. Yes.
So when the piles get complicated, which means it starts bleeding a lot, your hemoglobin drops, and which leads to weakness and other problems. The piles come out and then they become painful, what we call as prolapse or thrombosed piles. Then you definitely need treatment. So when the piles start bothering you, you need treatment. As far as fissure is concerned, I think fissure should be treated right from the beginning so that it can be nipped in the bud. As I said, 80% of the fissures don't need surgery. So if people come forward early, get their fissure diagnosed, start the treatment, they will not need any surgery at all for fissures. Surgery can be totally avoided except if you ignore it for too long and don't take action. When it comes to fistula, now fistula 100% treatment is surgery. There is no other option. Surgery can be, traditional surgery, which I'm talking about, or there are Ayurvedic centers which have what is known as Shar Sutra, where they put a thread around your fistula. The Shar Sutra treatment is a very long treatment. It takes very long. But if somebody is shy of coming to the hospital and getting standard surgical treatment, they are free to use that because it also works, though it takes a long time. And those who are in a hurry, they should come to us. Then we can do a laser fistula surgery and get the things sorted out. But fistula has no other option but surgery. Having said that, as most people ask, fistulas do not lead to cancer. And
Yeah, that was my next
fistulas,
question. In fact.
if
Yeah.
if you are willing to live with your fistula and you say that ठीक है भाई fistula है, थोड़ा पस आता है, मुझे कोई प्रॉब्लम नहीं है, मैं बाकी की जिंदगी ऐसी रह लूंगा, मुझे हॉस्पिटल नहीं जाना है, then that is also fine. If you are willing to live with your fistula, go ahead. But the options are two: either you live with your fistula or you have a surgical treatment. There is nothing in between.
Right. So here are two important angles and questions. One from a female and one from a senior male. Subarna Rana, doctor, I have external piles after pregnancy but without pain. Which medicine is good for cure, or do I have to undergo surgery? That is her question. And Mr. Harish Iyengar says he is 73-year-old male and is thinking of a surgery for a prolapsed pile grade 3. Is surgery good option for a elderly male? So here are two cases where we see piles very, very commonly. One is the age. Second is the pregnancy in females.
Right. So the pregnancy in female, again, what happens during pregnancy, the intra-abdominal pressure increases. As we were talking about, all this is a pressure game. So when the pressure increases, piles can develop in these people, and after the pregnancy is over, then hopefully the piles will go away, which is what happens in most people. Those who have history of family history or those who have other lifestyle problems, the piles can persist, but most of the times they go away. When you are talking about external piles, what you basically have is you've had a fissure during your pregnancy, and in a fissure usually you get what is known as a skin tag which comes outside. So if you remember, I don't have to ask you, but I can be sure that when you did have piles in your pregnancy, they must have been painful and it was mistaken for piles. Actually it was fissure. So now your fissure has gone away, but you are left with these skin tags. Now these skin tags are of no consequence. They will not do you any harm. They will not become piles. They will not become cancer. It is only of nuisance value. So if you don't like those skin tags, if you find it a nuisance, then you can have it removed surgically. It's a very small surgery. It hardly takes 2 minutes to remove them. If it's not bothering you and you are comfortable living with it, then carry on with it. As I said, it's not going to cause you any harm.
Wonderfully, because you have thrown light. Any number of women in pregnancy go through the pressure of rectum, constipation, and fissures. There is so much of cut. They discuss it with their gynecologist. I think we silently endure. I remember while you were talking, I went back to the time that I was pregnant and I did go through certain amounts of fissure, bleeding, and how did I manage? I was looking at it. And now the burden of not able to speak to your physician or not able to approach your physician, that is creating a larger issue. I am so glad that we are able to talk about these things here now. Earlier, when I'm talking about 25, 30 years ago, where we didn't have this kind of information and people were not ready to talk about it, doctor.
Sure. And the second question was regarding a third degree pile or a prolapsed pile in an elderly person. Now here, what is important is that once you see your doctor, he is going to get you assessed about your fitness for surgery, which would mean an anesthetic checkup. if you are a diabetic, hypertensive, have heart disease, etc., or those things have to be checked up. Once we find that yes, you are fit for a surgery, then you should undergo surgery, because as time passes, as you grow older, a complicated pile, which is a prolapse pile, which is causing you problem, is going to cause you more problem. So if you are 70 today, you will be 75 years 5 years later with the piles getting worse, and when you are 80 years later, it will be even worse. And then lot of people regret, people who had surgery done at the age of 80, they regret, they say, oh, ye to mujhe 60 या 65 के एज में ही करा लेना चाहिए था. I would have also had the benefits of living a piles free life. So meet your doctor who will get you assessed for your fitness for surgery. If you are fit for surgery, please get the surgery done.
Dr. Arun, here's Mr. Harishanga's additional input here. How effective is laser surgery for rectal or third degree piles prolapse, and is it safe for elderly?
Sure. So when it's a prolapse pile, the laser may not be as effective, because you also have to remove the cut off that extra piles or extra tissue which is hanging down from the rectum, and there probably a traditional surgery would be better. In traditional surgery, we can use laser to cut, or we can use electricity to cut, but the classic laser surgery, which cutless surgery, which people talk about, those surgeries work better when the piles are more internal. But if something is hanging out, the laser is not going to shrink the skin part away. The laser does shrink the piles part away, which is the internal pile. So there is an internal pile which is inside the rectum. There is an external pile which involves your skin. So the piles part which involves your skin, that will not go away. But the internal part which is causing the bleeding, that will definitely go away.
Right. So Naveen Simons is asking the next question. Hello, doctor. I was diagnosed with polyps. Is it also a piles related issue?
Okay. Now, when we are talking about polyps, I have to make one very important announcement here. That is that sometimes you can have bleeding, which is due to a cancer in your intestine. These people, when they come to me or to any doctor, when we examine, we will find piles there. So the bleeding can be wrongly attributed to the piles, while the bleeding was actually happening from what this person has just asked, the polyp, because the polyp in the intestine can cause bleeding, or cancer can cause bleeding. So when the surgeon sees piles which do not seem to be bleeding, and in that case, patient should undergo what is known as a colonoscopy to rule out other causes of bleeding. So bleeding from the rectum does not always mean piles. It could be coming from the intestine, the large intestine, for which a colonoscopic evaluation is very important to rule out polyps and cancer. This person concerned, when he says he has a polyp, then during colonoscopy, that polyp will be removed. It will be sent for biopsy, and after microscopic examination, once we find out what is the cause of the polyp, further treatment will be advised to this gentleman. So when he has a polyp, he should undergo colonoscopy. I assume the fact that he knows he has a polyp means he's had a colonoscopy and he knows what kind of polyp is there. If it has been removed, if it requires surgery, the doctor will advise you surgery. If it does not require surgery, then usually you will be advised to repeat the colonoscopy every year to make sure that no new polyps form.
Wonderful. Thank you, doctor. So next question is about a 17-year-old boy. And Ayush is asking the question, is piles possible in a 17-year-old boy? Blood with potty in interval, is it piles or not? One, people think that piles are only for elderly age group or yeah, pregnancy mein aate hai. It's not for younger age group. Is it true, doctor?
No, it's not true. In fact, pediatricians will tell you that one of the common things which they see in children is fissures. The reason being lack of fiber in their diet, not drinking enough water, and the incidence of this with our current lifestyle, or in the WhatsApp era, it's actually increasing. and we are seeing more and more of this. So yes, it is definitely possible to have piles in the younger group, but majority of these are fissures, not piles. Those who develop piles in younger age group are people, as I mentioned earlier, who have got a family history and they have, genetically weak blood vessels which are there.
Huh. So how much of one aware person? What's the frequency of they being getting tested? What are the tests available other than just meeting the which doctor should they go to, and what are the tests that they should get done?
Right. So piles, fissure or fistula are diagnosed by examination. So this is not something you will be able to diagnose by a Google search. Most people who do Google search of this end up imagining and spending restless night thinking they have got rectal cancer. So you need to visit a doctor. The doctor can be a general surgeon, a surgical gastroenterologist, or a proctologist. So it comes under these three categories, and any of these doctors you meet, they will need to examine you, examine your rectum, maybe with a torch or with their fingers, and they will be able to give you the answer. You don't need any further test to come to a diagnosis of whether you have piles, fissure or fistula. When we are talking about fistula, and you need to find out if it's a complicated fistula or a simple fistula, then the doctor will advise you to have an MRI of the fistula, what is known as an MRI fistulogram, which will tell us how complicated the fistula is, how many branches it has, how high level it is going. And the other test which I mentioned, which sometimes the doctor will advise you if he is not convinced that the piles are the cause of your bleeding, is a colonoscopy. So these are the two tests, colonoscopy and MRI, which you may be advised. But you need to first see a doctor, and clinical examination is most crucial.
Wonderful. So next question that with the diagnostics that I want to ask is कि anemia हो सकता है in case that there is a chance of anemia. Is that a complicated piles में होता है, or what kind of piles can cause anemia?
Yeah, so anemia can be due to blood loss. So it all depends upon how much blood you are losing during bleeding from the piles. It is similar to people having menstrual problems. If somebody who is losing too much blood during menstruation, the hemoglobin drops. But to a certain level per month, certain amount of blood loss will not lead to anemia. Anemia means the piles are severe and they require intervention. Anemia also means that you should have a colonoscopy to make sure there is no other cause that is leading to this bleeding.
Right. So post surgery, while we discuss the options of injection, band, laser, and traditional surgery, so can we also talk about the recovery stages of each of them, sir?
Right. So as I said, most surgery these days, you would need to stay in the hospital for a day. And based on the severity of your problem, you could be out of action, like at home for 3 to 4 days. In a week's time, most people are able to go back to office. Worst case scenario, 2 weeks, again, your surgeon who's going to do the surgery will explain to you. People who have fistula surgery end up with a wound. So in fistula, what happens? We cut open the fistula and there is a wound near your rectum. This wound, however, is painless and you can just put a dressing on it and carry on going to work. The wound can take few weeks to heal, but it's painless and it does not prevent people from carrying out their regular activities.
Okay. So while we talk about the surgical recovery and other options, people are also asking about the costs concerning the surgeries. Mr. Arif Zahir is asking, what costs are we talking about when we have a laser and a conventional surgery at Apollo, assuming 3 to 4 days of stay? So, ये 3 to 4 days of stay की जरूरत पड़ेगी क्या sir?
No, 3 to 4 days. So it's an oxymoron. You cannot have laser surgery and stay for 3 to 4 days.
Okay.
So laser surgery means either you go home the same evening or you go home the next day. Now, cost of treatment can be divided. If I say, now that's not just for pile surgery, but for any surgery which we are talking about, is the same classification. One, it will involve the cost of the equipment. So a laser equipment, the laser fibers usually could cost between 10 to 20,000. And in a simple scenario, 10,000 is probably the minimum that it would cost. Then you will have the hospital bed charges. So now the hospital or the nursing home bed charges differ from place to place across the country, from hospital to hospital. It's like going to a one-star hotel or a seven-star hotel. So the bed charges could be rupees 500 in a simple nursing home. It could go to 20,000 in a corporate hospital in a single room. So that varies. So that gets added. The surgeon fee would also depend upon what institution you are going to, and again that would vary. So you have the equipment charge, you have the surgeon fee, the anesthesia charges are there. So just as a ballpark, supposing the surgeon fee is say 5,000, usually the hospital would charge the same amount as an operation theater charge. So if the surgeon fee is 5,000, you would pay another 5,000 as the operation theater charge, and about one third of that, say 1,500, as the anesthetist charge. If the surgeon fee is in a smaller center 2,000, then accordingly the treatment cost would be there. So the medications, the equipment, the surgeon, anesthesia, and room charges, this can give you a total of how much it would cost. It could vary from 10,000 at a small center for a non-laser surgery, 20,000 at a small center for a non-laser surgery, to 2 lakhs at a corporate hospital, depending upon where you go.
Yes. Coming back to a simpler way of addressing your piles at the earlier level, that's taking care of your lifestyle. So let's come back to fiber, hydration, and other lifestyle issues. Mr. Ashish Kumar Panda is asking, what kind of fibrous diet can I add in our daily diet or lifestyle to control piles?
Yeah. So anything green is good. That's the simple answer. So have lot of salad, fruits, green leafy vegetables, seasonal fruits and seasonal vegetable God has given us, nature has given us. Please make the full utilization. So based on the season, nature gives you appropriate fruits and vegetables. Please have that. Drink enough water, and then if it's not sufficient, sometimes people need artificial, so you have things like isabgol and other things which are there for people to use. Then there are a lot of home remedies which people use, things like radish juice, or triphala, isabgol I have already mentioned, aloe vera gel people apply in the rectal area, people apply coconut oil. So there are a lot of these traditional treatments also. If you benefit from that, please go ahead. And then we talk about traditional treatment. There are many Ayurvedic oils which are available, which claim that the inflamed piles or piles during a problem, it helps them. We have also heard about using of neem leaves and anar peel. These are things which help. And of course the classic Indian treatment, which is haldi. So haldi works at many places, and it also, the haldi paste is supposed to be good when you apply in the inflamed area to give relief. So these are certain traditional things which have been mentioned. But when it comes to lifestyle, drink enough water, have enough fiber in your diet, sleep on time, early to bed, early to rise, the usual things which we have heard from our grandparents. Lastly, I would like to add here is that when we talk about carbohydrates in your diet, I'm also a bariatric surgeon. I deal with weight
Yes, I
loss
wanted to
surgery.
come to that question here, doctor.
So,
Can I
so when
also highlight that you are awarded, you have been the if I can call the ambassador of understanding the complications and bariatric surgery के बारे में काफी सारा आपने research भी किया हुआ है. That's your experience. Now, can I relate the situation of obesity in Indian population, and thereby the pressure, or can obesity also cause piles, constipation, and lead to piles?
Right. So we're talking about obesity. Thank you for your compliment. So when we talk about obesity, obesity does not directly cause piles. But the things that have led to obesity will also lead to piles. The reason you have been led to obesity are certain lifestyle problems, certain deficiencies in your diet, and those lifestyle problem and those deficiencies in your diet along with obesity also make you prone to piles. So obesity does not go cause piles, but piles and obesity have the same background. And what I was talking about here was carbohydrates. So when you are taking carbohydrates in your diet, now everybody has internet on your phone, check the glycemic index of the carbohydrate you are taking. So if you are taking food which have a high glycemic index, that's bad for you, not only for your obesity, but it's also bad that it can cause diabetes, it can lead to hypertension, it can lead to heart problems, and of course it can lead to piles related problem. So try and have carbohydrates which are of low glycemic index, and that will be automatically translating into your improvement not only with piles but also with diabetes, overweight, your problems of high cholesterol, uric acid, many other issues will get solved. So low glycemic index food is the buzzword today. Whatever you are eating, just check on the net that what is the glycemic index of this particular atta I'm eating or chawal I'm eating.
So while I've done all of these, doctor, I've checked my lifestyle, I've checked my fiber, I've checked my obesity, exercise, सब मैंने किया और surgery और whatever treatment remedy भी मैंने करवा लिया है. What are the chances of my piles recurrence का क्या chance है मेरी?
Okay, so now when we talk about recurrence, the classic treatment where we do surgery and remove all the piles ideally should not lead to any further piles, because piles form in three particular veins which are there in the rectum, and if we look at the rectum as a clock, the piles are going to form at 3, 7 and 11 o'clock positions, because these are the three areas of the blood vessels. In surgery we are going to remove these three, so you should not get piles. Some people do get what is known as secondary piles, which is blood vessels in between, if they continue to abuse the lifestyle after the piles treatment. But these secondary piles, usually we are able to give injections and treat it. So after a classic surgical treatment, piles should not reoccur in anyone. If it does, it's bad luck. When it comes to stapler surgery and laser surgery, yes, there is an incidence of pile recurrence, because sometimes the entire pile may not have been addressed, or it may not have shrunk because we don't have a microscopic eyes. We just remove that area or destroy that area with laser without opening up the area. So as we have not opened up the area, we assume that we have destroyed everything. So based on experience and surgical skills of the person who is doing it, you could have 10 to 20% recurrence of piles after a laser treatment, which I think is all right, because considering laser is totally non-invasive, if out of 180 people are satisfied and 20 or 10 people require a surgery at a later date, I do not think that should be an option. So laser is definitely a treatment of choice these days, provided you are aware that yes, there is a 10 to 20% chance that you might require surgery at a later date. However, people with complicated piles, prolapsed piles, third degree, fourth degree, I think it's best to just go on with traditional surgery and get rid of it once and for all.
Right. So while we talked about many of these interventions, which are modern and latest, what are the non-surgical treatments other than the injection and the band? What are the non-surgical treatments?
So non-surgical treatment, we have already covered with the lifestyle thing, where you have to make sure that the pressure is not there. Then the non-surgical treatment comes to injections, which are there for the piles, creams and ointments which are there for fissures, where as I say 80% of the fissures get healed without the need
So
for any
OTC
surgery.
नहीं, prescription creams है. While we say that there are creams, people should not run to
Yes.
the over-the-counter medications.
Yes, yes. And OTC cream भी अगर कोई ले रहा है क्योंकि they are hesitating, तो उसमें एक ये टिप है, just make sure there is no steroid in that cream, because steroid can be harmful. The non-steroid cream at worst क्या होगा, उससे आपको फायदा नहीं होगा, बट उससे कोई हानि नहीं होगी, लेकिन स्टीरॉयड क्रीम से आपको हानि हो सकती है, तो इसलिए स्टीरॉयड को अवॉइड करना है। फिस्टुला, जहाँ तक कि फिस्टुला या बगंदर का सवाल है, उसमें नॉन सर्जिकल कोई ट्रीटमेंट नहीं है, या तो आप फिस्टुला के साथ जिंदगी भर रहिए या फिस्टुला की सर्जरी कराइए, देयर इज नो नॉन सर्जिकल ट्रीटमेंट। सर्जरी में भी यू डू हैव एन ऑप्शन ऑफ द आयुर्वेदिक ट्रीटमेंट, यू कैन गेट Shar Sutra done at an Ayurvedic center where they will do it without anesthesia. Warning there is it takes a long time to get cured.
Yes. Right. So pain. Now that we've understood that piles and pain are not associated, but pain and piles are talking about a coexisting issue. So what is pain telling us here? What is somebody living with piles and managing piles in a different way, waiting for the right time to get treatment done? Agar pain hai, to what is it indicating?
Right. So pain is a signal from the body कि कुछ गड़बड़ है। अगर मैं अपनी उंगली मोमबत्ती, जलती हुई मोमबत्ती के ऊपर लगाता हूँ और उस जलन से मुझे पेन होता है, तो बेसिकली पेन इज टेलिंग मी कि आप वहां से हाथ हटाइए क्योंकि आपकी उंगली जल सकती है। सो पेन इज अ वार्निंग थिंग। पेन का मतलब कुछ गड़बड़ है। पेन इन फिशर मीन्स देर इज अ स्क्रैच देर इज एन इंजरी इन रेक्टम, प्लीज एड्रेस इट। Pain in piles mean that there is the piles have got prolapse, they have got thrombose, they can get infected, they can lead to infection, abscess, other problems, severe bleeding. Please address that. Pain in a fistula situation means that there could be another fistula brewing up, there could be some pus formation, there could be some infection in the tissues around your rectum. Please address that. Maybe you need antibiotics, maybe you need surgery. So pain is a warning which nature gives to us, and God has made this pain as something that gives you a warning. Otherwise अगर pain नहीं होता तो लोग कुछ भी करते रहते।
Yeah. So we need to understand certain things like fever and pain, which are important signals within the body, and react accordingly. Wonderful. So anything else that you would want to add today that our audience should know, the newer technologies or the newer methodologies of treatment?
So I think more or less I have covered. I can just sum it by saying that this is a lifestyle problem. It is totally preventable in 99% of the cases. 1% cases where people have a familial or a genetic tendency, there we can't do much. But 99% cases, piles, fissure, fistula are totally preventable. When you do get
basic
this,
question
please.
पूछूं sir, एक basic question पूछती हूँ sir. अगर ये problem है, I know that most of the women in their pregnancy can go to their gynecologist and then they open up and say that this is a problem. And gynecological procedures में ये भी बताया जाता है कि watch out for these symptoms. So women to a certain extent are able to get that kind of relief. But most of the men, young boys that we were talking, the 17-year-old boys से लेकर the 70-year-old gentlemen तक, are unable to reach out to the right kind of medical professional. Who is the first line? Who is the base? किसको touch base करना है at the first level?
तो वो मैंने बोला जनरल सर्जन, जीआई सर्जन ये होते हैं जो कि आपको देखेंगे और जो एग्जामिन करेंगे. सो यू हैव टू गो टू अ डॉक्टर हु इज एक्चुअली capable of doing a local examination, a rectal examination. So rectal examination is very important. Anybody who treats you without doing a rectal examination is just treating you by guesswork.
Correct. So ये ऑनलाइन नहीं हो पाएगा, ये डिस्टेंट में नहीं हो पाएगा, ये बिना एग्जामिनेशन के नहीं हो पाएगा. कोई एक्सरे या कोई ब्लड टेस्ट, कोई भी ऐसा चीज नहीं है जो आपको गारंटी एक रिपोर्ट दे.
हाँ, फिस्टुला में यस एमआरआई से आपको पता चल सकता है, लेकिन आपको फिस्टुला है ये कंफर्म करने के लिए किसी को दिखाना तो पड़ेगा ना.
Exactly. So don't shy away from what you have. It's going to land you in further problems. So let's not complicate things. So it's as simple as booking a consultation and visiting your doctor. So Dr. Arun Prasad, it was wonderful.
It takes less than 5 minutes for a surgeon to tell you कि आपको क्या है तीनों में से.
And treatment भी बहुत जल्दी होता है.
हाँ, मतलब 2 मिनट मैं देखने में लगाऊंगा, 2 मिनट मैं दवा लिखने में लगाऊंगा, 1 मिनट हैंडशेक.
Such a wonderful assurance that you gave us. So we'll wrap up with this kind of assurance, and let's hope that people are now more informed and have more power to take care of their condition. Now I would want you to give us top tips to prevent piles and manage them.
Okay. So number 1, drink a lot of water. Number two, early to bed, early to rise. Do not abuse your body. Number three, you have to avoid constipation by making sure you have enough fiber in your diet and you are taking enough carbohydrates of the low glycemic index kind. Next, as soon as you have some symptom, please consult somebody, because this is a problem that can be prevented, and it can be prevented to become complicated. So most of the times you are able to avoid surgery, avoid any complicated treatment. So do not ignore it. Please visit your doctor quickly. Lastly, I don't want to scare you, but there are other serious causes of bleeding like cancer of the intestine, which would require further evaluation and further test, which will make both you, your family member, and your doctor comfortable once that has also been ruled out.
राइट सो हमारे यहाँ ना सर जो रेगुलर व्यूअर्स होते हैं वो लास्ट मिनट में ज्वाइन हो जाते हैं एंड लास्ट मिनट में जैसे अभी आई एम क्लोजिंग द शो दे आस्क दिस क्वेश्चंस तपनज्योति एंड रम्या सर हैज आंसर्ड योर क्वेश्चंस वेरी वेल. Please go back to the recording. We are going to leave the recording of this show later. So please go back and find your answers in Dr. Arun Prasad's discourse today. Thank you so much, Dr. Arun Prasad. It was wonderful having you here on the show. Namaskar.
Thank you. Thank you. It was wonderful being there. Have a great time and have a good lifestyle.
Yes, with that great message from Dr. Arun Prasad, I'm now heading towards the health quiz, where you have to answer the questions over chat. And we need to, the winners will be announced towards the end of the show. Winners will be selected at the sole discretion of Apollo 24/7 team. And may I bring it to your notice that our email ID has changed, and it is not, it's not as shown as on the screen. But let me tell you, the email ID is marketing@apollo247.in. I repeat, winners, if I take your name to be the winner, you have to write back to us at marketing@apollo247.in, and that will be left in the chat box as well. Kindly, we will change this slide from the next week's show, and gift vouchers will be shared with you. चलिए आज के 3 questions screen पर डालते हैं. Question number 1 for today's health quiz: constipation or pregnancy can increase the risk of dash. Fill in the blanks, please. P blank L blank S. Constipation or pregnancy can increase the risk of, what is it? Fill in the blanks to create the word there. Question number 2, piles is a problem only for older people. Is that a myth or fact? Piles is a problem only for older people. Is that a myth or fact? Piles can cause anemia, true or false? Piles can cause anemia, true or false? That's the question number 3. Hey, Anmol, thank you so much for highlighting. Is it .org or .oin? So we shall leave it there. Yes, our admin has already left it. It is marketing@apollo247.org. Yeah, you have to, if you are the winner. Can we continue talking about the coupons? These are the 3 questions that we have placed on the screen, and here are the coupons that you can use on Apollo 24/7 to get a discount. Consult top doctors direct from Apollo at Ask Doc 150. This is the coupon that you use, and you get 150 rupees cash back on online doctor consultation. And the next one is first 3 FIRST3, 25% off on online medical orders, and you get 2-hour delivery as well. Use the code FIRST3. And the next one is exclusively for Health Hub viewers, which is HH247. You get 199 off on online consultation and 20% off on medicine orders. Thank you, Anmol, for highlighting that I've made a mistake in reading out. So you have to send your, if I take the winners' names, you have to send your names and contact details before Wednesday of every week to marketing@apollo247.org. Thank you so much for highlighting. And here are the next ones. I want to tell you that it is WhatsApp का number है जो save कर लीजिए 9355247247 to avail the healthcare services. And next week we are going to talk about menopause, the changes, supplements, prevention, care, what all it causes, coexisting conditions. How can you help your loved women to go through this phase of menopause when the hormones are failing and other problems are setting in? This is a very, very important for all the men and all the women out there in the menopause and the perimenopause, or somebody in your family is going through this, join us on September 29th, 11 a.m. and we are going to talk everything about it. So I'm waiting for our winners. The winners are Tapan Jyoti, Ramya Nagraj and Arif Zahir. Thank you so much for participating. We are also leaving a link of the email ID in the chat box, which is the correct link placed by the admin of Apollo 24/7 app. Please do check and write back to us with all your details, and the credits will be shared with you. Thank you so much. Namaskar. See you next week.